Rightio. So now we want to find these bastards. So how do we do it? Well, there's two ways to go about testing for BVD, right? Our two general tools that we use, our main two tools. I mean, we got some bulk milk testing, things like that, but our big tools really rely on two forms of testing, like for most diagnostic tests for diseases. You got antigen tests and antibody tests. Antigen's looking for the bad guy, so pieces of the virus or the virus itself. Antibody is looking for evidence that the virus was there. So that's what the immune system mounts in response to exposure. So these two groups of tools we've got some really well-developed tools that are highly sensitive and specific. And with these tools, we use them within our strategic management that we'll be talking about soon. So the antigen testing, looking for the bad guy, that's a direct indicator of PI presence. So if you got a bunch of calves and you're looking at them and there's a couple shonky looking calves and you ear notch them and you test them and it's a PI, well, that's a direct indicator of PI presence in that group of heifers. So you know that the rest of them are going to be immune. You don't need to do antibody testing, depending on how old they are, because if they're really young, there's some maternal antibody interference, but don't worry about that right now. But you got direct evidence that that group was affected by a PI during their gestation. Where there's a PI, there's usually more. The antibody testing is like when you ask an animal if it's ever met a PI, and it's an indirect indicator of PI presence. So if you got a group of young animals and they're all living together and they're all highly immune, that would indicate that they've had a lot of exposure to a PI, because without PIs, there's not much exposure. Now, one of the things to kind of keep in the back of your head, we're throwing a lot of stuff at you, but remember this, PIs themselves are always antibody negative. And that's because they think BVD is normal. You know, their immune system says BVD, it doesn't matter. It's no big deal. It's just part of me. And so they never mount an immune response. So if you blood test a PI, it'll come back antibody negative. So sometimes we get blood samples in from groups of at-risk animals, and people, when they're bleeding animals, tend to kind of grab some of the ugly ones because they think, well, that'll be more relevant to what I'm looking for. And so we might get, like, say, 10 blood samples from a group of heifers, and they're 9 are positive, 1's negative. And we'll go, well, let's run that negative on an antigen. And sure as eggs, quite commonly, that one's a PI. And that's the reason she's negative, because she's the one that caused the immunity in the others, but she's the PI, so she doesn't have immunity, if that makes sense. So when we're ear notching or doing the antigen testing, we are asking that sample, is this animal a PI? And that's when we're saying ear notch. And so when I'm rattling along and I go, let's ear notch an animal, what I'm saying is, let's test it for antigen. Let's find out if that animal's a PI. And it's kind of like, with like, where's Wally? So like the analogy I used before, you're like, where's Cletus in here? So PI testing is like saying, are you Wally? And so a lot of European countries have completely eradicated BVD just by testing everything. And in New Zealand, talking to Henrik, what they advocate is testing calves in the dairies, before group housing, when they're in individual housing, or if they do have group housing, to test them as soon as possible to find the PIs and get rid of them as soon as possible. And that's an "Are-you Wally" approach. Let's ear notch everybody. And I found that a lot of my clients didn't have appetite for testing everything because it's expensive, right? And that's not how we set up our programs here within the Australian Cattle Vets. We want to try to use serology to narrow down the groups that we want to chase Wally, and to find the other groups that we want to protect from Wally. So when we're looking at antibody testing, what we're saying, instead of, hey, are you a PI, is we're going, hey, mate, have you ever met a PI? And that's the blood test. So again, hey, like, you got all these dudes here. It's Woodstock. They've been there for 2 months. They're almost running out of food. They got a stone fence to keep them all in, bloody hippies. And you go around and say, have you seen that jackass with the black glasses and the red striped shirt? Everybody goes, oh, yeah, Wally? Yeah, heck, he's over there. That's why we blood test. Very sensitive without having to test every freaking animal. That makes good sense. So those are the two tests. One's asking if you're Wally. One's saying, have you ever met Wally? So we go back to the two types of BVD infection: transient infection, when an animal is exposed to functional immune system; PIs, when they don't have a functional immune system, they're born infected with BVD, stay infected for the rest of their life. So the transients become antibody positive and then virus negative. Now, they're for a narrow window when they're transiently infected. They might come up weakly positive on an antigen test because there's a little bit of virus there, depending on the sample. If you use bloods, it's more likely to give you a positive. But ear notches, there's not a whole lot peripherally. So they end up, so the blood test, the transient infected animal becomes blood test positive because it's antibody positive, and ear notch negative because it's not a PI.